Welcome everybody to day 3 of our 2020 virtual campaign kickoff. We're so excited to have everybody here with us today. As promised, we have a panel of rock stars from our health community. So today is going to be the health of our community, and I've got a number of rock stars to introduce to you today. Let's get up their bios here and close down a few screens. Okay, let's start with today's panelists. We have Missie Boone, and she is with the Crisis Resource Center. Holly Jorgensen is with Let's Smile. We have Vela from the Free Clinic of Steele County. Edna Ringhofer with Healthy Seniors of Steele County. And we have Kassy Nielsen with SCHRC. And I shortened it a little bit, Kassy. Okay, wonderful. Well, help us welcome our panelists today. We appreciate everybody that was able to hop on. I'm gonna go ahead and turn it over to Tom.
Well, thank you so much, panelists, for being here. Just a quick note on the format here. We're going to share the questions and really open it up for any panelists to answer it. We don't want to put anybody on the spot. If we have to, we can start calling on folks though. So the first question that we got from members of the community was that social distancing has become such a common phrase during the COVID-19 health crisis, but there's been a discussion that maybe physical distancing is a more effective term. Panelists, what are your thoughts?
I guess I'll jump in. Being that we meet with clients and we develop treatment plans with them, this is an interesting question. So I thought, when I read it, I was like, well, yeah, physical distancing actually seems a little more effective of what we're doing. Since we have a lot of clients centered around improving social skills. So when we're able to meet with them face to face with our social distancing in place, being that we physically can't touch them or be very close to them, and just kind of knowing that a lot of us, when we meet with them face to face in the community, we're working on those social skills. So it's interesting to see that, just knowing that keeping our physical distance has really, really been important for us through all this. So kind of taking that away from the actual social term. So that's just, it was an interesting question. So I thought, physical distancing actually seems a little more prevalent for us. So
I'm going to second what Kassy just said. I really like the term physical distancing versus social distancing. I think we're all very social people, and I love socializing with everybody, and physical distancing is just a much better term. Yeah, I like that so much better.
I can jump in. With seniors that we serve, the physical distancing is probably better as well, primarily because they are so isolated. So the more we can make contact and come into the home, you know, obviously following the COVID-19 rules, but having that one-on-one, face-to-face contact is so valuable, and we appreciate being able to do that.
I can jump into, I like the term physical distancing better too than social distancing, because like Holly said, we are social people, and it's important for self-care and for the mental health to, you know, be social and not be isolated. So I agree.
Lee, any final comments on that question before we move on to our next question?
Yeah, I was hesitating whether I should jump in or not, but yes, a lot of the people that we see here at the Free Clinic, some of them might come from another culture, and the fact that we're physically distancing, that's a great term. It makes things a little bit more difficult because they're more social, they're more, I guess, touchy-feely, and you know, if you make not seem to come off as very genuine, if you're not willing to, give a hug or give a kiss on the cheek or, other social norms and mores that are common in those cultures. So that is a bit of a struggle. And at least here in the free clinic, in the past, when we had people come in, we would have 1 or 2 patients, and then we would have extended family members come in. So sometimes we would have anywhere from 2 to 3 people to sometimes a dozen people or more to accompanying one individual. So given what we're going through right now, that is no longer the case. So it's a bit difficult.
Absolutely. Anxiety and stress seem to affect everyone as the global pandemic continues. What are some ways that you or your staff have been able to practice self-care? I know I changed it up. You have to think about yourselves for 5 seconds. It's very difficult for this group, I know.
I can jump in if you would like. So practicing self-care is very important for anyone's job and anywhere. It's especially important for healthcare workers and for like domestic violence advocates and victim services. So for self-care, we've been staying in touch virtually. Like we've been doing Zoom meetings. We've been calling each other on the phone. And now that we're back in the office, we're still actually doing Zoom, like video chats among our offices. And then that's important for self-care to be able to, because of confidentiality wise. So debriefing in the morning and afternoon. And then like we decorate our offices. So we, so then it doesn't feel like everything's closing in. And then I always recommend taking like a good 10 minutes at the end of the night to do like some sort of, you're not into meditation, doing like, there's a calming app, and it kind of blanks your mind for a little bit, and then you can just let go of the day. And so.
Great ideas. Who else? What other suggestions do we have?
My self-care is I take my dog for a walk every single evening. I just get outside and I enjoy the neighborhood. So I am a very social person. So in order for my self-care, when I'm walking the dog around the neighborhood, I'm saying hi to the neighbors and we can talk while they're in the driveway. And yeah, I just like to get out and see people. I'm getting my exercise, my fresh air, the sunshine, and that's the best way that I take care of myself.
Good ideas.
Well, and for me, I like to walk. And with seniors, I actually see a lot of seniors in my neighborhood when I do walk. And so that's been just a great, generally I like to hit that in the morning. And so I'm able to do a lot of friendly visiting out on my walk. And so that part is probably my self-care.
Wonderful. I heard Lee trying to hop in here. Lee, the floor is yours.
Thank you. I didn't know whether I should raise my hand or what, but my self-care, whenever I get a chance to, I love to cook. I love to barbecue. I'm mechanically inclined, so I have 2 older classic project trucks from the 50s. So I like to, turn the gears on that and get it going. And yeah, I do a lot of fishing and hiking I've been doing recently. As it is, as someone mentioned, if you're in the healthcare services and, people still get sick, people still need their medicines, and, it can get very stressing very quickly.
Very good. How about you, Kassy? What do you do?
Well, being in the mental health field, I think this is the time that I stress with my staff is let's take those, practice those skills that we're teaching our own clients. Take a walk over your lunch break, be outside. I encourage that as much as you can, get that vitamin D as you see them outside. But yeah, we have a lot more team meetings, and we like to, somebody said something about the dog. Ironically, all of us have a dog. So we kind of bring them into our meeting like, oh, Cooper. But so, yeah, we just try to boost each other, strategize together. mindfulness skills. So we talk a lot about self-care in a lot of our meetings, especially during this time. So.
Wonderful.
Well, the next question that we have for the panel is what tips or advice might you have for the most vulnerable folks in our community who either don't have the means or the opportunity to get outside during the global health crisis?
I guess I can start. We are able to teach a lot of our clients our video through Teams. That's what we're using, so we're staying connected that way. But when we are working with them through video or phone, because we have a waiver through the state that's allowing us to bill with that, we never were able to with that telehealth with ARMS. But we're encouraging them, you know, take those daily showers. Talk to somebody once a day, whether you text or check in with your mental health provider or a friend or a family, some kind of check in daily with somebody. And we're just really letting them know that we're all in this together. The struggle is, we're all going through this. And I think that helps not only them, but helps all of us and the others that they're communicating with to maintain their mental wellness through this time.
I'm gonna jump.
Oh, I'm sorry.
Go ahead, Holly.
Oh, okay. My tip right now, especially for people that can't go outside and they feel isolated, I am such a huge advocate for dental health care. And one of the biggest concerns, even just talking amongst with my friends, you know, just chatting, it seems like most people will brush their teeth and floss their teeth before they leave to go to work or before they leave to go to school or before they leave the house. So a lot of that now is kind of getting neglected because of the fact that they're inside the house, they're not seeing anybody. So why should I brush my teeth and floss my teeth? Because nobody's going to see me anyway. So that's getting hugely neglected. So right now there is a huge evidence that are supporting that if your oral health, your dental health, if you have, you know, inflammation, infection in your mouth, you are more prone to have a lot of symptoms from COVID. You're more at risk of having a suppressed immune system because you already have an infection in your mouth. And so you're going to develop the symptoms of COVID, or even just getting sick with the cold or flu or anything like that. You're going to be more run down if your mouth and your dental health is not healthy. So my tip for anybody who is isolated and staying at home, please make sure that you are brushing and flossing your teeth every day, whether or not you're going to see anybody, because that's the best way to keep your oral health. Definitely affects your overall health. And so really need to make sure that you're keeping on top of that, as easy as it is to forget since you're not going anywhere.
And just remember, when you put that mask on, guess whose breath you're smelling? Your own.
Yeah.
Edna, did you want to jump in next?
Sure. You know, we work with caregivers that are caregiving for seniors that may have dementia, Alzheimer's, Parkinson's. You know, and the number one, I guess, word of advice is for our caregivers is you need to take care of yourself first. And so we make a lot of phone calls. We do also provide a lot of respite, but that is one thing where it's not unusual for us to be just listening on the phone a good 30 to 45 minutes, just listening to them vent. And if that's what it takes to relieve some of that stress and burden, that works for us. So we're more than happy to do that.
Awesome. Missie, Lee, who'd like to go next?
As far as any tips for the most vulnerable folks in our community, a lot of the people that we see here are from a different culture, and family is number one. And you know, I just tell them to be safe, and you know, even though they're with extended family or close family, you know, better safe than sorry. Wear your mask. And so, yeah, just be safe and try to follow as much as your as you could your life prior to COVID, but keeping in mind everyone's safe and keeping everyone safe and healthy. So, yeah.
Wonderful, thank you. Anything you'd like to add, Missy?
That even if you are isolated, our services are still available 24 hours a day, 7 days a week. If you're experiencing domestic violence or child abuse, or you just need to know what options there are for you, or like you're looking at putting a plan in place of leaving the situation that you're in, we're always here for you. I know when you're stuck in the household with your abuser, it's difficult to reach out for help. It's difficult to call. So what we've been doing is, because we're still offering all services in person, but we've also accommodated like Zoom and video chat for those that can't get out of their home, so that they can still see a person talking to them. And so like that's my best advice for people, is try to reach out for help. I mean, even if you can only talk for a good 5 minutes, reach out. Also, you can always, if you're in immediate danger, you can always text 911 if you can't do the phone call as well. So, and if it's something that we don't offer, we can always give you a phone number to find the services you need. And then shelters are still open during COVID. I know there's a misconception going around that, shelters aren't taking new people. Domestic violence shelters are still open and they are still taking people. So there is help. Don't hesitate to reach out for help. It's my best advice.
And that's good to know. A couple of things that people may not have known, and that is that you can text 911, so if you can get 3 digits and you can do it behind your back, that's definitely an option. And it didn't used to be an option. So that's good to hear. Thank you guys for sharing. We're gonna turn to some positives here. So I'd like it if you guys can share an example of a positive success story or collaboration that pleasantly surprised you this year. I know, it's how do we pick one, right?
I know, that was my thing. I was like, which one should I share? Because I could sit here and talk for like 2 hours, but I want to make sure everybody else gets a chance to share. So one of my favorite collaborations is, Let's Smile. We are in the Community Pathways building on Wednesdays. So not only do we do our school-based dental clinics, but we're in the Community Pathways. So it's like such a fun partnership with them, because we're eliminating a lot of barriers for people that are having a hard time accessing dental care services. And so a lot of times, so pre-COVID, we're doing COVID too, but so basically, but pre-COVID is the families would come into, I'm gonna say their old names, the food shelf and the clothesline, because I know a lot of people aren't used to their new names yet. And so while the parents would come in and they would be doing their shopping at the food shelf side or the clothesline side, and their kiddos would be there, a lot of times, Let's Smile, we've got openings, and I'll be like, hey, are your children, are they current on their child and teen dental checkups? And if they're not, then I'll just bring them right in. We do walk-ins, and we get them all up to date on their dental health services. While their parents are shopping, they can be in the room with us, or they want to shop. It has been such a huge collaborative win-win-win-win for everybody, because the parents are knowing that their children are getting taken care of. They haven't had to arrange for any other transportation to get to a dental office. They don't have to travel out of town. 80% of the children and adolescents that Let's Smile sees are walk-ins at the Steele County, at the Community Pathways. And then again, our other collaboration is with our school districts. And so we're removing barriers for families to access dental care services. This is very critical, that they don't have to worry about, do I have to take a day off from work? No, you don't, because we're in your schools. So, or do the kids have to miss a whole day of school to travel to Mankato or to Rochester? No, you don't. They only miss maybe 20, 30 minutes of classroom time, and we never take out a kiddo during testing time. So they're right there in school. They're not missing critical, valuable classroom time. We also eliminate the fact that, well, I got an appointment. Oh, darn it, I just forgot it. Nope, you're there, I'm there, we're all there. Let's just do this. So Let's Smile, we are all about removing barriers because we know how critical it is for children and adults and adolescent, everybody, to access dental health care, because again, that just affects your overall health. So let's remove those barriers. And I'm really fortunate that we're in the Community Pathways building right now. So yeah, that's us.
What's up next? Edna.
Well, we're for Healthy Seniors, we're actually in the Senior Place building. However, since COVID, that has been shut down. But the great part about that is it's kind of a one-stop shop for seniors and caregivers. So that part's been just a great collaboration because seniors like to be out and about. They like to have the recreation, but yet then they're also able to get the help and the referral, or we set them up where if they want to volunteer or if they need a volunteer to come in, we're able to do that all in one place. So that's been a great collaboration for Healthy Seniors with Steele County.
Wonderful. Missie.
I can go next if you're done, Edna.
Yeah.
Okay. So like we collaborate with so many area agencies to begin with. I'm very fortunate because every time we need some sort of help or assistance or referral or anything like that, we've always had that nice working connection with area agencies. But during COVID, it's been kind of difficult, but one thing that I've find fascinating is that every agency has broke out some sort of contingency plan to still get those services out to the community. And I mean, I'm surprised with that because within the first few weeks of the state shutting down in March, it was like everybody had a plan in place, whether it be Zoom, Google Meet. Our agency meetings are still happening. They're happening virtually, but we're all still able to provide the services. So it's very amazing and fascinating. So I don't have just one, but overall.
Wonderful. Kassy, Lee, who'd like to go next? Kassy?
Sure, I'll go. I don't want to say I have so many, but I'm kind of refocusing my previous story that I was going to do. But this was specific to a client that we worked with during this COVID time. Her cancer came back, which we were fearful with deterioration of her physical health, but also her mental health and how that really affected her. And then we were able to start groups again, and she was not able to participate due to doctor's orders and high risk vulnerability being that her cancer was back. But we work with her individually one-on-one with the service and really kind of helping her stay connected to people through video or phone conversations. And we just try to kind of give that boost of, she had a lot of anxiety and what was to come. But then she was able, I'm kind of really shortening the story. I could talk an hour about it, but her numbers have stabilized. Her doctor gave her the okay to start coming to groups. And so her peer members in the groups, I was able to see just the light up in all of them, and not keeping that physical distance in our group settings, of course, outside, but just how much it really has improved her mental health, and kind of seeing that light of her perspective now, still going through her blood works and her appointments, but that peer support and how much that has really just, for her to see somebody in person other than just going to her doctor's appointments and being part of that social group again, just kind of lit everybody up. And so we're so proud of her where she's come through all this time, and it was really exciting to see her back with her peers in our group sessions. So yeah.
Great story. Lee, do you have anything you'd like to add? Do you have a success story you'd like to share with us today?
Can you hear me now?
Yes, we can. Welcome back.
Okay. Thank you. Like Kassy, I'd like to share someone that we helped here at the free clinic with their dental problems. Earlier this year, there was an elderly individual that was living on a fixed income, and they were on medical assistance, and the dental backup list or the line was very long, so she was in extreme pain, and she had multiple teeth that needed to be tended to and extracted. So we were able to, this was right around shortly after everything started happening in regards to COVID. So we were able to get her referred to the oral surgeon here, and we got her out of pain, and she didn't have to go into the ER anymore, which was crucial because, you know, we were told to try to not go to the emergency room if it wasn't quote unquote an emergency. So nobody should have to go into the emergency room because they have a molar or a tooth that hurts. So she was very, very grateful for what our dental staff, volunteers did. And, you know, she was very, very, very grateful. She brought us cookies later that week. So, I mean, it's just, you know, you can't put a price on, you know, seeing someone that's in extreme pain and then you being a part of helping them feel better.
Absolutely. That is great. You guys, can you believe it that we're almost out of time? So I'm going to have Tom ask our last question, and then we're going to wrap up this segment of our health panel. Go ahead, Tom.
Panelists, we're wondering, what is the final message that you have for the community? What do you want to leave Steele County with here today?
Strongly want everybody to know is that your oral health definitely affects your overall physical health. I know that people think that just going in and getting your teeth cleaned could be just a cosmetic thing, but it's not. We're eliminating bacteria, we're eliminating infections in there that definitely affect your overall body. So if you have good oral health, dental health, you're going to have, first of all, a better self-esteem because people do notice your mouth. And if you do have decay in your mouth, that can affect you socially. It can affect you mentally because you don't want to be openly smiling at everybody. You want to hide it. It can affect you physically. Like I said, with if you have an active infection in your mouth, it affects your immune system. The bacteria gets into your bloodstream and it can affect all sorts of organs like your heart and your lungs, everything else that infection gets in your body. It can affect just so many different aspects of your life. So good oral health prevention is powerful. And that is what Let's Smile's about. We're all about the power of prevention. And that's what I want you guys to take away from today, that it affects every aspect of your life.
Edna, you're up next.
Okay, well, I would just like to say to everybody, you know, if you are caregiving for a senior or you know a situation, please call us. We're able to go in the home and help reduce that stress of caregiving. We're also able to do a lot of different things that are centered around what that individual case is. So it's very important to know that there is a support system for seniors here in Steele County, and it's a special thing that we do have. Not all communities have that, and so I would highly recommend that. But also too, I'd like to say thank you to the community itself, because without your support, not only our agency but several of our agencies, we couldn't do this without you. And that's what makes Steele County a really special place, because it's been such a great place to live, but to see that support go to so many great organizations, and we're able to do a lot of good. So thank you.
Wonderful, thank you. Kassy, I see you're unmuted. Would you like to go next?
Sure. I guess for me, in like all capital letters, is please just take care of yourself, mentally especially. And you know, we ourselves have anxiety and maybe a depressed mood through a lot of these changes through this pandemic and everything. But in order for us to really be effective with our clients who are, you know, really struggling with mental health issues is just taking care of ourselves. You know, it's okay to take a day off. It's okay to mentally, you know, organize yourself for the day. Just take care of you. You know, I think that is just one thing that we're saying continuously, at least through our agency, is really just taking care of yourself.
Absolutely. I see we're at time, but we're not going to end here. We're going to hold on everybody here because we'd like to hear from Missy and Lee, and then we've got some final comments for you. So Missy, would you like to go next?
Sure. So one thing that I do want to emphasize to the community is domestic violence has no boundaries. It can affect every single person, along with domestic violence victims. Abused children is another program that we have at the Crisis Resource Center, and they kind of go hand in hand. And right now with the people losing their jobs, kids not being in school, there's a high number. It's gone up. And without like the support of the community to keep us going and the support of the United Way, because we've had a long relationship with the United Way, we would not be able to provide the services we do provide. But don't hesitate to pick up the phone. Our services are 100% confidential. If I ever see you out in public, I don't acknowledge you, but we have no judgment at the office. It doesn't matter if you've left 10 times, if you've left twice, if it's your first time, take that initial step to reach out for help because it's very important.
Absolutely. Thank you, Missy. Any final words, Lee?
Yes. The Free Clinic of Steele County sees residents of Steele County, any resident of Steele County that is not, for the medical side, that is not insured, that has no insurance. If you're on MA, we can't help you. For the medical side, for dental side, we see residents of Steele County that are not insured or have medical assistance. We are a free clinic. We do not bill for our services rendered. And on the medical side, we rely exclusively on volunteer medical providers from Mayo Clinic and Alina Hospital here in town. And I've been here in this role going on 6 years coming this February. And we are a United Way agency. So what we do is thanks in great part to the United Way. And so we, like someone said earlier before my turn to speak, there's a lot of people that are losing their jobs or are working less hours. So, you know, you never know when it might hit you. You know, you might be good one day and you might be furloughed or laid off the next. We've seen a lot of people that have that need to be seen by a medical provider or a dental provider. And so yes, that's why we are here. That's why we exist. And but at the same time, we are a very small agency, so we are very, very limited with our resources. And so yeah, we have to look out for our local community because there are some people that, you know, can't make it out on their own because some of them are going through a difficult time. And so yeah, it's a group effort, I guess, if you will. We rely exclusively on volunteers and we rely heavily on the United Way as well. So thank you for the opportunity that you gave me to speak.
Well, thank you, Lee. Tom, I'm going to turn it over to you to wrap up for us today.
Well, thank you to all of the attendees who've joined us here on the third day of our virtual campaign kickoff. We really hope that you'll consider joining us tomorrow as well for our panel on a path towards financial stability. So please come back and join us again tomorrow. Very special thank you to all of the panelists who took time out of their very busy day. Thank you, Missy, Kassy, Holly, Edna, and Lee for sharing some of your insights, but more importantly, again, for everything that you do each and every day to fight for the health of every member of our community. And a big thank you to everybody that's watching this later on. We We would encourage everybody to head on over to our website, unitedwaysteelecounty.org, for more information on COVID-19 resources or for ways to give and join the fight and live united. Please visit our website, unitedwaysteelecounty.org, or you can even text to give. Text UWSC 2020 to 91999. Again, that is UWSC 2020 to 91999. Thank you all so much for joining us. We hope to see you again here tomorrow.
Wonderful. And we do have a closing video that we will end with today. Again, thanks for holding on. I know we're a little bit over our time, but Tom, why don't you go ahead and pull up that video and we'll wish everybody adieu.
Aquellos de los que nadie habla en las fiestas, nosotros los buscamos. Sin importar los obstáculos ni las probabilidades, enfrentamos los problemas más críticos de cada comunidad y luchamos contra ellos. En United Way luchamos por la salud, educación y estabilidad económica de cada persona en cada comunidad. ¿Y tú, lo harías?
Thanks everyone. And again, we hope we see you tomorrow. Have a great evening.